Hi, I'm Dr. Lucieto, and I'm back again to talk to you about your health, which is so important it should not be taken seriously. The topic at this moment is osteoporosis and osteopenia. Osteoporosis is a very serious condition. It is a condition in which you have an increased risk of fracturing your large bones as well as your small bones, but the large bones, that is a definite concern, because if you break a hip, if you break a vertebrae, if you break one of the larger bones in your upper arm, it definitely impairs your ability to function. Now, when a person has osteoporosis, sometimes they can actually fracture a bone by doing something as simple as sitting in a chair, walking. They don't have to fall. They don't have to have a lot of pressure applied to them. That's one of the reasons why older folks are at greater risk, because as we age, we can lose our bone mass. There are different reasons to cause us to lose our bone mass. Just as I explained, the use of steroids can do it. Menopausal state can do it because of the changes in hormones. Estrogen is an important chemical that helps us maintain our calcium level in our bones. The whole condition of osteoporosis and osteopenia, it's not just a simple do one thing and it will get better. It's kind of a complex network. So things that feed into it are your caffeine consumption, alcohol consumption, smoking, medications, exercise. So as I explained in previous interactions and videos, you have to understand that balance is the key. Aristotle had a good idea when he wrote his Aristotelian ethics about a balance. You can have everything, but not too much of anything. I think it's a good guide, because there are certain substances you should not take part of, but we will talk about those in another video. So one of the things you can do without even having to talk to your doctor is, particularly if you're of menopausal age or premenopausal age, you can start taking a calcium supplement. But taking a calcium supplement can be a little more complex than we'd like it to be. Many people go to the calcium carbonate supplement, which is a good supplement because it's better than taking nothing. It's usually sourced from oyster shells, similar items. It's ground up, and you usually have to take about 1,200 milligrams a day in order to absorb the amount into your body and into your bones that you need to kind of keep ahead of this bone loss or bone resorption. The whole biochemical process of bone loss has to do with these little cells that do a lot of work rebuilding our bones. They're called osteoclasts and osteoblasts. But just as I promised you that I'm not going to quiz you later, and I'm not trying to teach you medicine, I just want you to understand why we need to do what we do. I'm not going to go into a great deal of detail about the osteoclasts and osteoblasts. So the calcium sources are an interesting concept, because the three main ones are the calcium carbonate, which is probably one of the more common ones. There's calcium citrate, and there's calcium hydroxyapatite. Now, the calcium alone is not enough. In order to absorb calcium properly, you need to also have vitamin D in your system. And a lot of us don't have enough vitamin D in our bodies. We need to actually supplement that because we don't get enough from the sun. The other supplements that we need are vitamin K, and there are other things like boron and zinc that help. All right, because the bones are not just calcium. All right, they're a protein that have calcium hydroxyapatite in their scaffolding. Now, one thing to keep in mind about the bones is they're actually part of the hemopoietic system. And what I mean by that, there's bone marrow in your large bones, and that bone marrow manufactures many different things, including the cellular component of our blood, as well as some of the humoral components, which are like the proteins. Most of the proteins are made by the liver, but we do have some that are associated with it because there are certain cells that are involved in helping to make and maintain them. But again, this is a process that can get a little in-depth, and we don't want to do that because that does not serve our purpose. Calcium carbonate is probably the most common because it's cheaper. It is the least expensive option of the three. Calcium carbonate is sourced mostly from oyster shells, although there are other sources that are used for calcium carbonate. Calcium citrate is usually sourced through a fermentation process, and calcium citrate can be used for other purposes in the body, which we won't get into because it doesn't have to do with bones. We also have calcium hydroxyapatite, which is my own personal favorite, and I'll explain to you in a minute why I like this one so much. The calcium carbonate, calcium citrate, calcium hydroxyapatite are all available without a prescription. But the important thing is, regardless of which calcium supplement you choose to take, you need to take it with vitamin D. It's also helpful if you take a little vitamin K, but we don't want to nickel and dime things. You might be able to get a lot of that from your food because your food is your best source of nutrients. But it's hard to find enough of the different foods that are not processed as much to provide a lot of these nutrients. So if you have osteopenia, which is a lesser form of the osteoporosis, or if you have osteoporosis, it's important for sure that you supplement your calcium. If you have normal bone density, that's wonderful. Thank God for it. Thank everybody for it. But you should consider taking the calcium supplements if you're higher risk. Higher risk would be female, menopause, use of steroids, alcohol use, smoking, all these things increase the imbalance of the osteoclasts and osteoblasts. The osteoblasts are the cells that actually build bone. And the osteoclasts are like your little Pac-Man that chew up the bone. And these two cells are supposed to live in balance, but as we age, there are other metabolic processes that kind of reverse that. And maybe your osteoclasts are busier than your osteoblasts. That's not good because then overall you're losing bone, and you don't want to lose bone because if you get thin bones, that starts a whole cycle of pain, fractures, not being able to go out of the house without bubble wrap. It's not pretty. You want to be able to live your life. Life gets more difficult as we get older anyways, for reasons, lots of different reasons. So when you're young, take advantage of it and be happy that you don't have to take all of these supplements. But it probably wouldn't hurt, even for individuals who are of a higher risk group, to maybe consider taking a little bit of calcium every week if they're not going to take it every day. Now, calcium carbonate is a good choice. Its probably biggest advantage is that it's the least expensive, but it's only about 5% bioavailable. And what I mean by bioavailability is that you take it in and your body absorbs what it can, but it's only going to be incorporating about 5% of what you're consuming. The rest of it, out the poop chute, doesn't get absorbed. Now, part of that is because it's a mineral, all right? We don't tend to absorb those very readily, which is one of the reasons why we have to have cofactors. Like vitamin D is necessary to get calcium into your body, just like vitamin C is necessary for iron to be absorbed. So you have to kind of keep in mind that if you're dealing with a mineral, you've got to have a cofactor. Calcium citrate is another good choice. It's maybe a little more expensive than calcium carbonate, but one advantage from the calcium citrate is that it's a little easier to tolerate on the tummy, because when you're taking the calcium carbonate, sometimes you just feel like you got rocks in there and it's not a happy day. You get a little bloated, and who likes that? Not everybody can tolerate calcium carbonate, so then they choose calcium citrate. That is made actually through a fermentation process. Calcium citrate is used in other situations of healthcare, but I'm trying really hard to stay on the osteoporosis and calcium supplements. The calcium citrate is 7% bioavailable, which means for every 100 milligrams that you're taking in, you're absorbing 7 milligrams. Just like with the calcium carbonate, you're absorbing 5 milligrams out of 100. So you're absorbing a little bit more, which is a good trade-off, but you're also paying a little bit more. Then we're coming to my star, my absolute favorite, the calcium hydroxyapatite. That one is very similar to the calcium hydroxyapatite that you find in your bones. That's what they're made of. So isn't it better to substitute like for like? It is more expensive, and sometimes that's a showstopper for people. I'm not an advocate for choosing supplements over your food or your rent. Not an option. You take care of your food and your rent first. But calcium hydroxyapatite is 95% bioavailable, which means if you take 100 milligrams along with your vitamin D, you're actually absorbing 95 milligrams. Isn't that wonderfully not wasteful? And it's good for your bones. There have been some studies that actually show by taking this, you actually reverse this whole osteoblast imbalance, and you're able to deposit more calcium into the bones. The other advantage is that by using calcium hydroxyapatite, you're building not just lamellar bone, which is usually the bone that you see on the outside of a bone. Lamellar means like a flat plate. You're also building trabecular bone. The other two supplements don't really help you with that because you're struggling to get it into your bone and absorb it in the first place. But trabecular bone, that's where it's at. The trabecular bone actually adds strength to the bone because it's kind of like a bridge that has your struts and everything, and that provides so much strength. So it builds lamellar bone as well as trabecular bone. So if you can't tell, that's my favorite. I like the idea that it's 95% bioavailable. The cost, though, can be an issue. There are also some supplements out there that actually have the calcium hydroxyapatite, the vitamin D, the vitamin K, all in the same capsule. And that kind of cuts down. I remember there's one that I take. I absolutely love it because it doesn't upset my stomach. Calcium carbonate, oh my gosh, made me just, couldn't tolerate it. And if you can't tolerate, you're not going to take it. So what's the point of buying it if you're not going to take it? The calcium supplement that I take, everything is in the same capsule. And I actually priced it out. And I figured out that it's more expensive to buy the individual components than it is to buy the expensive little capsule. That's why I take it. Do I take it every day? I'm a patient too. Now, will the calcium supplements completely reverse the whole osteoporosis osteopenia? That kind of depends on how deep you've gone down that well in order to get into the state that you're in. You might be able to use it to prevent the problem from happening or to reverse it if it's just in the early stages. There are other medications. There's lots of stuff that can help you rebuild bone, but you still have to take the calcium. You can't just take the bisphosphonates or the other medications. I know I'm trying so hard not to say the names. I don't want to have a problem. But there are a number of medicines out there that will help rebuild your bone. There are some that actually stimulate the osteoblasts in order to make more bone. That's when we start getting into the treatment. So I should probably refrain and maybe go do some charting. It's been a long day. I think I need some tea. But thank you for your attention. I hope you have a great day. And if you have any questions, particularly when you come to the office, just ask me. I'm more than happy to address them. So you guys have a wonderful day and stay cool because it's awfully warm outside.